I'd like to call the meeting to order. This meeting is being recorded. I would ask if there's anyone else recording this meeting. Seeing none, would you please join me in the Pledge of Allegiance? I pledge of allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome, everyone. We now move on to citizens' comments. Do we have any citizens' comments? We have a lot of citizens here. Seeing none, we will move on to the approval of minutes for, special recognitions.
Thank you, Mr. Chair. I'd like to just point out to you, I know last week we celebrated that Julia Bancroft was a National Blue Ribbon School of Excellence for work that's been ongoing for over the years, but also want to give credit. We have Mr. Hanfield here from Auburn High School, and Mrs. Kim Norris is here as a representative from Packagug. She's the teacher in charge. And if they want to just come to the podium to get their due accolades for the great work, I know that's exciting to do. But they've both been recognized as commendation schools. These coming from the state of Massachusetts, and as indicated in the letter that I included in your packet, with Packagug and Auburn High School, there are only 2 of the 42 schools across the Commonwealth, and there being about 350 or so districts. This really is an exceptional honor, and both were recognized for narrowing the achievement gaps, which really is something that we take quite seriously in the district to make sure that each and every one of our students achieves at high levels. So I just wanted to congratulate both Mr. Hanfield and his team, and Mrs. Norris and the team from Packagug and Mrs. Cozen for the great work that they're doing as well.
Thank you. Do we have any comments, or did you want to start off, Mr. Hanfield?
You know, again, I mean, those of you who are new to the committee will get to hear me say this, I think, a lot. The credit really goes to our faculty and to the kids in the classroom. You know, I'm just proud to steer the ship over there. The work that they put in, you know, that people don't see behind the scenes, both the kids and the adults, is really what makes things like this possible tonight. So I'm here on behalf of them, and I'm just proud, again, to add to last week's accomplishments that we can also recognize this as, it is a fairly substantial accomplishment. 42 schools out of 358 in the Commonwealth, and I was quite surprised, pleasantly, when I opened the envelope from the commissioner last Monday. So that's really all I have to say. Thank you.
Thank you.
Thank
Ms.
you.
Norris?
And you know, as a team member, I'm a proud member of that team. Thanking the people I work with. I've done it for 21 years at the same school. Great staff, great parents, can't forget the parents, and a great bunch of kids. So it makes going to work every day really fun. So thank you.
Excellent.
Great. Thank you
Any
both very
comments?
Through the chair,
Yes.
I would like to congratulate you, your staff, the students, and certainly their parents for all this hard work. I mean, this is an awesome award for Auburn, and we thank you for it sincerely.
Well said. Any other comments?
I just want to say I agree with her in her statement, and she said it all right there. But, I mean, keep up the good work, because you've been doing a real good job, and I've seen a lot of improvement in the schools, and it shows how good you all are working together. And I want to thank you, too.
Great time.
I will share a quick story. As I was telling Dr. Brunel earlier, at my school, we dropped a little bit in MCAS scores, and so the curriculum coordinator did a little presentation, and I just want to say that Auburn was really shining in that PowerPoint. We really stood out as a district, especially the high school, not to take anything away from the other levels, but we really did, and this is just another indication of the great job that you're doing, that the faculty's doing, and as you said, our students working hard to make this happen, and thank you. It really feels good to stand out like that.
Thanks.
Thank you.
Thank you. Yeah, great job.
Thanks.
Very impressive.
We actually do have an additional special recognition. Each year, the Harvard Book Prize is awarded to an outstanding student, a member of the graduating senior class, who, as they have in their application, combines excellence in scholarship and high character combined with achievement in other fields. And this year's recipient is Megan McQuarrie, class of 2015, and she and one of the guidance counselors, Mr. Brutus, attended an event at the Harvard Club in Boston recently. So congratulations to Megan, and I look forward to sharing other such awards that students receive throughout the year. Really is a nice opportunity.
Excellent. And that's all for special recognition?
Yes, it is.
And it doesn't appear that we have a student representatives report tonight?
It's senior night for athletics, so I think that they're probably
We
at
get
those
their
events.
awards, okay, excellent. I now will seek approval for the minutes of the October 8th meeting. Do I have a motion?
I'll make a motion to approve it.
Do I have a second? All in favor?
Aye.
It is a vote. We now move on to the superintendent's report.
Thank you. So the first presentation that we have, if you can see here, we have our school nurses from Auburn. Ann El Said and Margaret Collins are the nurse leaders. And they provided a very comprehensive packet of information in the packet, but they also are here this evening to go over some of the highlights of that in a PowerPoint presentation. You have a copy at your seats, and would also be willing to answer any questions. And I do, as I noted in here, really thank our school nurses for their expertise and their diligence in helping to not only keep our students safe, but also our staff as well, and provide guidance and counsel for us. So with your permission, I will turn it over to Mrs. El Said and Mrs. Collins.
Welcome.
Thank you. Good evening. We're happy to be here, Margaret and I, to give you a little presentation in PowerPoint. We would like to acknowledge that, we don't work alone, and our names are up there, but we represent a big group of colleagues, 6 nurses, 7 actually, because we have a nurses job share at the high school. So to acknowledge Glenn Sullivan, Dottie Valancourt, Cheryl King, and Joe Trong, and also Long Dong is not here this evening. So we are representing some of the data that we collected from our work last year, and just some information to give you about what we do in the schools to help the students really learn. So that's what we're here. I'm going to try not to read, but excuse me if I do. So we have a PowerPoint presentation with a brief overview of our work. Data from last school year and information about the role of the school nurses and how we support the education of our students. Our primary goal as nurses is to provide high-quality nursing care to our students, to keep students healthy and ready to be in class and to learn. So that's a primary goal. This is a highlight from our National Association of School Nurses has put together a presentation, and this is just part of it, about 5 ways school nurses benefit any school district, but of course we put our school district up there. How do we benefit the schools? By helping with attendance. We certainly do a lot of health promotion. We certainly are doing a lot of hand washing teaching right now at schools, nutrition teaching, sneezing etiquette, that kind of thing. Disease prevention and management, again, obviously a kind of important issue at this time of year as we go into flu season and some other concerns in the country. We do ask ill students to stay home and give parents some guidance about that. We will send students home if they are ill or we are concerned about any kind of contagious activity. This leads to improved academics, just literally because we hopefully keep students in the classroom and ready to learn. Long-term attendance shows improvement in the rate of students not dropping out. So this starts really early on, as we're all involved in that from our preschool, kindergarten, all the way through to the high school to help with attendance. We also they have shown that the school nurses have saved the other staff some time in the care of students, the principals, teachers, clerical staff, just because you have a dedicated person to take care of any issues that come up. We also do some wellness with staff members. We see whoever comes in our door, quite literally, so if there's something that comes up. One of the nurses was helping someone labor the other day, so some surprising things that do happen in the clinic. We are accountable for federal and state regulations, and one of the things we're have 4 of our school nurses working on right now is an immunization survey that the Department of Massachusetts Public Health puts out every fall for our preschool, our kindergarten classes, and our 7th grade, just really to report how our students are immunized. If we have the majority of them immunized, they would question if they're not and why not. So it does make Massachusetts one of the states that's very, has a high compliance rate with immunizations, and again, an important factor. There are 9 school health service activities that we're involved in. I won't really read them to you, but we will kind of highlight a few of these as we continue. They all really lead us to provide high quality, we hope, to our students and to our staff. Taken in total, they support our primary goal and help us teach students about their health, ways to make healthy choices, when to ask for help for illness, to avoid injury, and hopefully that healthcare professionals are caring, helpful, and approachable for now as they're going through school, but also for the future, so that they know when they have when they have an illness or a concern that they will approach another healthcare professional. We do see that as a long-term goal also. So the types of encounters that we have a total number of 34,556 throughout the district. Some of those are illness assessments. Illness assessments can range from quite a few things, from sore throats, coughing, wheezing, sneezing, respiratory involvement, and gastrointestinal symptoms, any kind of item that might come in the door that the student has that might be classified as illness would come into that category. Injury and first aid has quite a range too, also from paper cuts to the more serious concerns with concussions, injuries on the playground. Sometimes we see injuries that happened outside of school, perhaps on the ball field or at home, and we would make an assessment and possibly make a referral or at least take care of that. Mental behavioral health, we do see quite a bit of this at different age groups, of course, anxiety, depression, different school issues, social issues. We work in conjunction with the guidance department and the administration around those issues. Other is, and miscellaneous is a category that includes such things as self-care assistance, sometimes incontinence care. Some of our students need help with their equipment, such as hearing aids, or we've done repair to glasses. We do quite a bit of different things in the nursing office. And medications and treatments is obviously another big category that comes to our door, really helps keep children in school. So that's, now this is a slide that explains really what happens when students come to us. The majority of us do return to class. We have over a 95% return rate to classroom after a visit. That includes students that come in for medications or treatments, and hopefully they would be going back to class, but of course if we assess something that is of concern, we might call home or most often home or a doctor's office. Dismissals is for illness or injury. That's a fairly low percentage, 4%. And other would be the students might have to go on to talk to a guidance counselor, refer to the administration or principal for perhaps a bullying issue, that kind of thing. This is a slide that just gives us a little highlight about how often we see students. We see everyone for the screenings that we do, but there are different percentages of students that might actually seek us for care for injury, illness, or some other things. So as you'll see, the younger students, they see 100% of their students at one point, one thing or another. I'm sure for some of the students it's just to make sure they can get to the nurse's office and back for the first time. But at the range that I'm in, I'm at Packagug School, 3rd, 4th, and 5th. And over at Julia Bancroft, we're at the 95 to 96% of the students we saw last year. And the high school and middle school, I think also a very high percentage for that age group, at 76% of the students will make their way to the clinic for something. One of the major reasons we are there is to help provide medication management, and shows quite a bit of what was prescribed and what was given permission by the parents and ordered by the doctor to give the students. Some of them are scheduled medications. Largest of that is the psychotropics and the insulin administration. The PRN is as needed, so if a child doesn't have it ordered, for instance, asthma medications before a physical education class, but they're running a mile and they need it, or they're doing something else and they need it, then we have an order for that for them, if the parents have provided or if we've had concerns about that. Other prescriptions and over-the-counter account for many different kinds of meds and just don't make that classification. We do health screenings, hearing, vision, height and weight, and do the BMI calculation. Postural screening, which is looking at the spine for any kind of changes in those. Particularly the postural screen is done through 9th grade, and particularly when the students are growing, so that we can refer them for follow-up with their physicians for care. We do have the summary of our BMI results. And as you can see, 30% of our students are in the category of overweight or obese. 69% are normal. We do fall into a general normal level for the area, so it does sound a little high, but it's just what's going on in the general Massachusetts community. We don't fall really any higher than normal. There's certainly other districts that might have a higher percentage and some won't. Margaret's going to talk a little bit about our special health care needs students we see, and show you some of the tools that we might use in the clinic to help our students.
Thank you, Ann. I brought a few tools tonight, just to give you an idea of some of the hands-on things we do. And the first thing I'd like to talk about is diabetes care. So I brought a glucometer. This is something we'd be using in the clinic to check our diabetic students 2 to 3 times a day, depending upon their age and what their needs are. Our goal, of course, is to maintain a very level blood sugar, if possible, as close to normal as we can get. The students would come to us at the beginning of the school year with their parents and provide us with a diabetic kit, which would include all the necessary tools that we would need to use. The glucometer, a ketone tester, insulin, syringes, snacks, juice, some sugar tablets if needed, and we'd be working with the doctor's orders. And most of the students have a carbohydrate insulin ratio. So at lunchtime, we'd be sitting with them and looking at the lunch before they went into the cafeteria and calculating the insulin coverage according to how many carbs they're going to eat. It's very unusual to find students today with a regular sliding scale as in the olden days. We cover them according to what they're eating. So we calculate that. We make sure that they're getting the right amount of insulin. The older children at the middle school and the high school level they're more involved in their care. They can deliver their own insulin. However, the nurses can verify that, make sure that they're looking at the glucometer to make sure that level is correct and that the correct level of insulin is being delivered. So although they're older and can care for themselves, the nurses really need to be on board and help them and support their activities in the school. Let's see. And I wanted to just talk about when we have a low blood sugar, something that's very, very low or very high, we would be contacting the diabetic providers to notify them of the abnormality and to just communicate with them, see if we need to provide any additional treatment. We'd also be working with the parents. Diabetes care is a very team approach, as well as involving the teachers at school. They're there in the cafeteria. The cafeteria monitor is helping us to make sure that the students are eating their lunches, and everybody is aware of who the students are in the building who have diabetes. And then I wanted to just talk about our students who may have a G-tube that requires a specialized feeding. And some of the students in the district do get their feedings through G-tubes. And a G-tube would be put into place through an incision in the abdomen, and going directly into the stomach. What I'm showing you here is the connection for that. This would be connected through the button so that the nurse can provide either a lunchtime feeding, sometimes it includes snacks as well. This would be inserted through a syringe into this tubing, and we can either provide that through, by using liquid feedings from a can. They also have blenderized feedings, which is something that's fairly new coming out of the feeding clinic, but you use actual food according to a recipe. This would be considered a doctor's order. It's taken, protein, vegetables, fruit, oil, flax seeds, put into a blender, blenderized, and then inserted through the G-tube feeding. So that is something that we have done in the district in the past, and, we continue to feed students this way. I wanted to talk about EpiPens. I don't have any EpiPens here, but we do have EpiPens in all of our schools. This would be dealing with the students who have very severe allergic reactions. We would have stock EpiPens. Those would be the EpiPens that we have received from the EpiPen for School program. And we also have EpiPens for students who have known allergies, and the doctor would provide an order and we would have an EpiPen kept for that individual student. At the beginning of the school year, we go through a training with our staff so that they can recognize the signs and symptoms of severe allergic reactions, and they also know what to do in the event that a nurse were to be out of the building or on a field trip. We can delegate this as well. And then we spend a lot of time with respiratory care, so I did bring some of our respiratory equipment. We have a pulse oximeter, and this is just a simple tool that's put on the digit of the child so that we can get an oxygen reading. Of course, we use our stethoscope. That would be even more important to listen to their lung sounds and see how they sound, look at their color, look at how they're sitting, what is their posture. We would be treating them with an inhaler if they have one ordered. And I have brought the nebulizer machine just to kind of show you that we have the bigger machine. This is used for our more severe asthmatics. You hook that up into the outlet in the wall, put the tubing in here, and the medication goes in here, the liquid medication. That would be when they would wear a mask or a mouthpiece. The liquid medication is turned into a mist so that it can be inhaled deeply into their lungs. That takes a little bit more time, about 15 to 20 minutes, but the goal is to improve their situation so that they can go back to school. They would be reassessed. If their lung sounds are clear, they'd go back to the classroom. And I think that's all I have, just to show you some of the things that occupy our time in the nursing office, just to show you a little piece of what we're doing.
That's it, and we'd like to thank you for this opportunity, thank Dr. Brunel for the opportunity to come before you, and thank all you for your support, and our principals and the people we work with in the building. We work a great deal with PT and OT and guidance counselors, and even the IAs and the ABAs. We're all working together as a team, but we'd like to acknowledge the support we have, and we appreciate it very much. I don't know if you have any questions.
Are there any questions, comments?
I have a couple questions, actually. The BMI testing, do you guys find you get backlash from that, from families in the community, or has it been pretty well accepted?
It's been pretty well accepted. I think in the beginning there was, in the very first year that it came down from the Department of Public Health that it was a requirement. I think people were very questioning, why do we have to do that in schools? I think as time gone by, and we've been very confidential about it, and we've been providing education and any letters that do go home by mail to parents, I think we find that it raises the awareness that this is a time to perhaps do something about it if there is a concern. Hopefully have a physician involved in the conversation, maybe go to a nutritionist or think about options. So it has gone fairly well. I think there aren't that many that even have written to say, please don't do a height and weight of BMI calculation.
That's good, because it opens the door and gets people talking about it too, so.
Exactly.
My other question was, the students with diabetes, do you find that they're getting outside education on their disease, or is it more they just really have no idea how to care for themselves?
Oh, no, they're getting outside
They are,
education as well, very much so from the primary care provider that's dealing with the diabetes, as well as their family.
Okay,
We're
great.
just an additional support,
Mhm.
and we do feel very much part of the team with the family and the providers,
Oh, good.
working together, trying to make this work, because it becomes challenging. I'd say even at the older level, the middle school and the high school, they really are trying very hard to fit into their peers, eat the same kind of food their peers eat. They want to be just like their peers, and they're growing, their hormones are changing. That's a very trying time in their life. But most definitely, there's much support at home and with the providers that are caring for these children.
Good.
It's a newly diagnosed student, which we do sometimes see right out of hospital release. They go home, they come back into school. I think that's when there's really a large support system, both from the hospital providers and parents, but there's also a lot more teaching going on, I think, from the clinic, because there's an acclimation period, and the nurses will be right in the middle of that, seeing the students 5 days a week and working with the parents around those issues.
Yeah, because you see the students most of the day, so yeah, you would be the ones, enforcing the rules and stuff. And then one more thing, I read the report and I think it was really well done and very informative, and you guys did an awesome job. And 34,500 visits. I know my daughter is 500 of those visits. Mrs. Sullivan, you're a gem. I love you. So, yeah, great job, guys. It was really a good job.
Any other comments, questions?
Through the chair, I have some questions.
Yes, ma'am.
With all the talk right now about contagious diseases, do you feel that you have like masks and gloves and necessary things like that you should have in the clinics?
Well, we do have masks and gloves. I think the H1N1 kind of got us ready. We certainly don't have the full body kinds of things
No.
you see on TV.
But for that entero,
Yes, we
you
have
what you would
masks
need
and gloves.
if any
yes.
of that was
And
around.
We do certainly have that. Ideally, the good and the bad of the enterovirus is that it might be come and gone, and we might not even know. It
Sure.
takes a week to get diagnosed. So I'm presuming it's all around us, and we're just really kind of like similar to the H1N1 wave of the illness. We're trying to prevent, be proactive about hand washing, and really trying to teach kids how to take care of themselves when they sneeze or have colds, and when to send children home really appropriately. The
And-
asthmatic students, the students with asthma, I'd say we're all very conscious of the fact that we, ramping up our watching of them, and if there's any concerns, we'll pull them right into the clinic, and our faculty and staff are helping us with that if need be. They're all very aware of who might be at risk, so it is a team approach, and families are very good about letting us know, keeping students home.
Sure. Good. The equipment that you showed us, is that in all the schools or as needed, or?
No, that's in all the schools. All the nurses have the pulse ox. We obviously all have stethoscopes. I brought an antiquated nebulizer machine. I think most of us have better machines than that. But yes, we all have this in the clinic, as well as the EpiPens.
And is one of your duties still to call absent students that you haven't heard from the parents, or?
Yes, that's one of our duties.
But otherwise, the parents are supposed to still call the students in if they're not going to be out,
That is correct.
and then you follow up.
Yes.
Do we have many students in Auburn? Like, what percentage might, because of religious convictions, aren't immunized, or is that a worry? I guess is what I'm asking.
It's very low.
Very low.
Very low, I would say. Yes. The immunization rate in Auburn is very high.
Very high.
Very compliant.
Well, thank you very much.
Thank you.
Comments, Mr. Page?
I just have a comment. I think your presentation was great. I learned a lot more about what you do tonight than I have in quite a while. And it's good to get it out to the public to let them know what you as nurses are actually doing in the field, in our schools. And it gives them more knowledge about what's going on. It gave me more knowledge of what's going on. And as far as I'm concerned, any safety need for help that you people need, please go to the superintendent and have her come to us, and we can discuss what you need, and we'll get it to you. Because it's a big thing, it's health for our children in the schools, and you guys do a lot of work, and I learned a lot more, and I want to thank all of you.
Before we close, could I just have all you ladies come up to the podium? I know you didn't present, but come on, you're very valued. Just go on up there.
You just don't want them to get away with it.
So, I will echo in a lot of ways what my fellow members had said, especially what Mr. Page just said. If you ever find that you really need something and it's something financial that you don't have, come see Dr. Brunel, come see us. We'd love to provide it. And then I just want to say, again, the presentation was fantastic, and I had no idea. I really didn't. I understand some of the things that you go through, and I'm impressed with the way you handle the students who aren't sick, and just make them feel good about themselves and get them back to class in a timely manner. But I had no idea the seriousness of all the other operations that you take part in, and I just think it's fantastic what you do. I haven't heard any complaints. As Wayne said, this is the first time I've seen a presentation like this, and I'd like to see it more often. Maybe every couple of years you can come back and tell us what changes you've made or what you're up to, because really it's been a learning experience, and I'm sure it has for the entire board. And I just wanted to...
You should come visit us.
Absolutely. Well,
Our clinics are open.
We will be.
Come visit.
We will be.
we will be very soon. We'll stop in and see. We didn't stop into the nurse's office
No, I
last
don't
time,
think
did
we
we?
did. I
All
was just
right, well,
thinking that, yeah.
we'll make a point of that. Do any of you have any comments? Well, with that, I'd just like to give you a round of applause for all your efforts. Dr.
If I
Brunel?
may, just through the chair, I think it's great that you had them all go up to the podium, because it really is a team effort, as Ann and Margaret said. And really, the idea is about being as proactive as we can, the work that they do with our students to try and even prevent the spread of diseases. I know that recently there was a meeting held, I know Ann was there, I don't know if you were there, Margaret, or other principals, but with our Director of Facilities and the Board of Health representative to just look at and knowing what the concerns are out there, make sure that we're doing everything we can cleaning-wise and making sure that there's that communication. So it really is great, and there's a lot to be proud of, so thank you.
Well said. Thank you very much. Have a
Thank you.
great evening. We now move on to food service.
Yes, that would be great. So thank you for rearranging the agenda a bit. We have Mrs. Janice King here, our food service director. She also provided a report regarding looking at our participation rates. So with your approval, Mr. Chair, I will have her come to the
Absolutely.
podium and perhaps just give a brief overview and then answer any questions that people may have. But
Thank you for this opportunity to continue to look at other aspects of health and wellness for our children. School nutrition programs are really vital for the health of our students, and activity that we continue to review and fine tune is looking at the participation rates of our program. And thank you for inviting me to come and to talk about this. And we do take a look at a lot of the different factors that we've analyzed that contribute to variations and changes in our participation rates. And as a district, we're continually looking for improvements and enhancements to our programs that offer children the best nutrition that we could possibly provide. We did take a look at the September 2013 participation in comparison to September 2014. And we did see a drop in participation, and a lot of factors that go into that, taking a look at it. And we also took a look at 2013 for May, as well as May 2014, and we also saw a drop in the participation rates. But there are a lot of different influencers that impact participation in our school nutrition programs. Menus are no longer photocopied and sent home, and we started making that change in, I believe, March or April, to try to become a little bit more green, decrease the amount of paper. We had about 5 reams of paper, 4 reams of paper actually, every month that we were printing. So there were a lot of printing costs involved in it. And we thought that we would utilize the one-call service and make the menus continue to be available online. So we felt that that was a good move. Menus also have included a lot of additional options. We have continued regulations that came into play from the federal level in the month of July of this year. So we continue to be influenced by a lot of the changes that when we're looking at the national nutrition guidelines, whether there's sodium restrictions, whole grain requirements. And we also are bringing in a lot less processed food into the school district. It's been a substantial opportunity for us to take a look at what we have been providing our students and to make some qualified judgments as to how to provide foods that children still love, enjoy, but also making those ingredient labels a really important factor in making those choices. And we also applied for the USDA whole grain waiver for pasta. One of the significant challenges we've had in our programs is that we've been required to offer 51% whole grain products, whether it be a bread, a roll, a pasta, and the product that we were receiving from USDA was not receiving high student acceptance. So through the past year and a half, there have been a lot of changes in the regulations, and in Washington now there is discussion about completely overhauling these grain requirements. So we're hopeful. We did apply for the waiver and did receive it. So I think students are enjoying Spaghetti Day a whole lot more now. It was a very high participation day, and I think it's been a good move for us. We are also looking at ongoing reporting, assessing our participation rates, and we're also looking at the non-participation rate, because each set of data will provide various different information, and it allows us to look at evaluating the strategies to improve that participation. So I thought I wanted to just kind of talk a little bit about sales and participation. We have seen across the nation over the past year, there has been a decline in student participation in school meals programs of over 1 million meals just in the last fiscal year. We haven't received that information for this year yet, but a lot of programs have been opting to, really redefine their participation in USDA programs. Our district, right now, we have about 28% free and reduced numbers. Our numbers actually did increase 4% from this past March to this September. So the need for school nutrition programs to meet the eligibility requirements for students who are less food secure at home, we're filling those gaps. So we're really happy to be able to do that. We're also going to be looking, we participate in the French River Collaborative, and we're looking at ways that we can participate in some surveys or some evaluation of data that other school districts are experiencing, and we are seeing declines in our regional environment. For other districts, their numbers are also declining. There's an overall decrease in participation when we look at the data from January to September. Our free participation is about 73%. Even though students qualify for meals, it doesn't mean that they're going to be eating them or participating. We also saw a 67% participation rate for our reduced students. And for our paid students, we have about a 61% participation. Those are actually above national averages. Our national averages are generally in the 60 to 70% category. So we feel that we are, I guess, our participation is similar to other nationwide school districts, but we always want kids to participate because we think we are offering an amazing value-driven meal for them. For $2.50, it's very difficult for families at home to produce an entree, fruits, vegetables, whole grains, milk for $2.50. We did review the non-participation data, and we found that 97% of the students that are attending school on a regular basis, that's extremely high, and to be commended for all of our students and families that our children are coming to school every day. 68% of the students in one of the charts that you have show that students did purchase meals at school, but the one factor that we looked at also was that 32% of the students that came to school did not purchase a meal during the month of September. So that has us, raising some feelers out there. That's something that we need to look into. Look at the statistical impact of that from a financial perspective and also for our students to be able to participate more. But the majority of our non-participation is coming from 92% of the non-participation for the month of September did come from the paid student. So we're trying to, continue to assess that and take a look at what that means. So we do have some projected strategies to address this. We're looking at it from a multifaceted point of view. We're trying to address the non-participation of our paid student. And one of these pieces will be preparing a SurveyMonkey that will go out to the 4 categories of students, our K through 2, 3 through 5, 6 through 8, and 9 through 12. And I did reach out to other school districts in our region, and we will be the first to actually participate in sending out surveys. So I think they'll be looking to us to provide that leadership role. But we're going to continue to work on, developing specials. Our staff is very hardworking to offer samplings for our students, free items that are available for kids to try. We think it's a great opportunity. It sometimes takes 15 initiatives to help a child learn to enjoy a new food. And we're ready and able to make that happen. The other things we're going to be looking at is going back to the practice of sending our menus home to students, at the school level, to see if that does influence things. We also will be developing a separate menu, which is not included in your strategies here, but it's something I've been working on since I prepared this. A separate menu to actually go home to students at Bryn Mawr and Mary D. Stone that will be highly simplified to actually limit the number of choices. We will be looking at projecting the menu based on the highest participation level days for the month of September and the month of June. So we're going to continue to work at this. We feel that lots of opportunities still exist for us to continue to grow participation and improve the health and wellness. We will also be having by January a brand new website that will actually have more marketing and outreach to our families and to our students. And the nutrition information will actually be online. You'll click on a menu, and the menu line for whatever item will be on the menu will click you back to the nutrition information for that menu. So we're thinking that we're trying to approach it many ways, and trying to try and address the political football. There was a great article in the New York Times just recently. It's how did school lunch become the latest political battleground? So there's a lot of conversation in Washington and a lot of conversation here at the state level about participation meal programs. And we just hope our families participate with our children to really take advantage of these highly nutritious meals that we have available. And we invite you to all come to our school nutrition program on us. Come and see us. We want to have you participate and enjoy our meals.
$2.50, you said?
It's too much.
Sounds like a good deal. Are there any comments, questions?
Yes.
Mr. Page?
Yes, I brought the superintendent and asked her for this report,
Wonderful. That's fine.
because there seems to be some problem with people talking about the menu, saying they're having chicken 3 times in a week, and, they don't think it's right. And, the decline, if we're gonna decline, I understand what you said tonight, to try to correct that problem. But prior to that, there seems like there is a problem, and hopefully it's gonna get addressed. But I also heard that since these new regulation stuff goes in, if they have pizza, it tastes like cardboard. I mean, is
We're
this,
actually making our own pizza in the school district now, but we actually have expanded.
is that before the cardboard or after?
Actually, it was after. But we actually are, trying to create a balance, because we have had students that do prefer a stuffed crust Tony's pizza over.
Okay.
So, we're really very flexible. The menus that we have available for the month of October are going to be changing again. And a lot of it has to do with what's available through USDA. We, every month, we are offered a sheet that's available for us to select from, and a lot of the items that we have available are chicken-related. The price of beef is extremely high. I participate on the statewide USDA Commodity Council, and one of the things that we have heard just recently is that the price of beef is extremely high, and that truckloads from Massachusetts may not be filled because of the price. So, we continue to try and develop our menus and to try to reflect as many new menu items. If you notice, in the month of October, there were 6 new menu items available, and it is chicken. Tyson was awarded a very wonderful, we're participating in this amazing bid. It's whole muscle chicken. It's not chopped and formed and processed. The kids actually received a chicken leg this month, which is something new for them. And again, children still love a chicken patty. It's a very highly selected day for us, but we also want to try and help children experience some variety also. Yes. Follow
And
up.
that's what I'm trying to get at too. Is there another way you can give them a variety instead of giving them the chicken all the time?
Again, it depends on what we have available, but we do.
But I mean,
Okay, yeah.
the other thing, you're gonna talk about health about our kids with nutrition, but the other thing is the declining is hurting the issue, and if you don't have good food, you're gonna keep declining.
We
And
have.
then, I'll let you talk as soon as I'm done.
No, you're good. You're fine.
And then, what it's gonna do is raise the cost of the students that are there that are still getting the lunches. This is what I'm hearing. I'm bringing forward to you to hope somewhere in the works that some of it can get straightened out. And I think what you have said prior to this is a good way to start.
Okay, thank you very much. I do appreciate the feedback. The price of school meals actually is regulated by USDA, in that each year now, we are, the process of setting the meal price is actually set by USDA. The meal price equity provision in the Healthy Hunger Free Kids Act requires that we actually increase the price of school lunch every year. We may be asked to increase the price of our school lunch by the Department of Education this year. We're waiting, we're feeling that we need to, comply with those regulations, but we're not at that position right now. So we won't be increasing the price of the school meal. As far as what the participation rate does have a lot to do with the economy. That's one of the pieces in here, and I may not have verbalized it, but the economy does have a lot to do with our rising numbers of free and reduced students. It does affect, what students are able to actually purchase lunch. Maybe students purchase meals. The participation report that I presented was only the non-participation report for 1 month. So we need to be very careful, I guess, let's see how this data continues to, develop. And I'm very, very committed to making sure that we continue to be extremely sustainable. That's a real part of my job.
And
Yeah.
it's part of my job to make sure that the school system works the way it is, and to make sure our kids are safe and healthy and
Mhm.
taken care of in their education and all that and the other thing else.
Yep.
But I just think that there needs to be more of a variety in the food system. I
Have
don't
you
wanna
reviewed
sit-
our menus do you have menus, copies of menus? I can
I've
share
had
them.
some, yes. I don't have them with me tonight, no.
Well, I'd be more
But
than
I've
happy
gotten-
to sit with you
I've
at
gotten
any
some.
time, to talk further and, answer
Well, if that's fine with the
questions.
superintendent, that's fine with me.
Yes, so
Yeah.
through the chair, if I may, to those concerns that we do have regular meetings, Mr. Barber, with Mrs. King and myself as well. And, I think that nationwide, there has been a drop, and some of it is because of the new regulations that are out there, But, I mean, I think it's very appropriate that tonight's presentations were around from our school health nurses as well as food services, because they both very much interact with each other in providing for our students to make sure that they have healthy meals and then can be supported during the day. So I know that Mrs. King is committed to that, and all of us as a group, you know, to doing that. So we're going to continue to monitor it because we want to provide the best we can for our students, food-wise, medically, educationally, and all of the above.
Mr. Page?
I'm only bringing this up, Mayor, Superintendent, is because I've had questions about it.
Understood. Understood.
And I want to make sure that we're going in the right direction
Yep.
to take care of our kids and the food, and to make sure if there's something we can make better somehow, some way, I don't know, that's her position, not mine. But the thing is, when I get hearing complaints and everything else, I'm gonna look into it. And I'm more than happy to sit down with you any day, as long as it's okay with
Yeah.
the board and the superintendent.
So,
Dr. Brunel?
through the chair, we're all on the same page on that. We want
Okay.
to have, we're all about our commitment to excellence and continuous improvement. So
Right.
that's certainly the direction, so I'm very confident in that.
Gil?
Very confident.
I have a question. When a student goes through the cafeteria line, are there choices for them, or is everything like, this is the meal and this is all of it?
And that's some of the discussion we are looking at right now. We have many choices. We have 4 or 5 entree choices every day, 2 or 3 vegetable choices, 2 fruit choices, milk
Is this at all-
variety,
All levels?
all schools.
Oh,
And we definitely invite you to come in to see the variety that's offered, and definitely offer your suggestions, because it's always a process of development, and we're looking for, you know, input. That's good. You have a
Thank
question?
you.
Thank you.
Dorothy?
I just wanted to commend you on actually providing the nutrition information in the menu, because I know the kids are actually learning about this in school, and I think that that's fantastic. I'm a firm believer in prevention, disease prevention through nutrition, so I think that's really good. I also think it's a wise move that you are doing the menus home again, because a lot of times the kids don't see the one call online, so you can see it and get excited about spaghetti day. And also,
Yes.
that was always a great meal.
and I'm also thrilled to hear about the real food. I know many kids would be happy to get a chicken leg, especially the ones that don't have that opportunity ever at home. So I'm encouraged to hear that the kids are getting real food and getting educated on how to really care for themselves through nutrition. So great job.
Thank you very much.
Any other
Thank you all,
comments or
really.
questions?
Thank you.
Yeah, through the chair. I have just a couple things.
Yes.
I definitely think printing the menu again would be a huge help. I have a second grader. I never go online to look, so I just pack a lunch because it's easier. I feel bad for the environment saying that, but yeah, it's so much easier to pin it on the refrigerator and have it there. And then, do you always offer a vegetarian option every day?
We do, and we're going to be highlighting that more. We actually are involved with the Physicians Committee on Responsible Medicine, which is looking at offering more vegetarian food and menus in schools. Meatless Monday is a big national trend, but we also feel that a lot of people are flexitarian, that, you know, they're flexible to some days eat vegetarian and some days eat meat protein. So there's definitely more options that will be coming up. And
Yeah.
we're also looking at gluten-free. We're trying to meet a lot of diverse needs. The population is very different today than it was 10 years ago, 20 years ago. So we're looking at trying to, you know, make sure we're meeting a lot of food trends.
Yeah, it's tough because you're stuck between a rock and a hard place with, you know, the government pushing you one way and then the kids see salad and they're like, ah. So,
It is a balancing act because parents are looking for a healthy menu and children are looking for food I like.
yes, yeah. And they're
So-
very picky.
Yes.
Yeah.
So
I think you're on the right track. I think sending home menus again would be a huge help. though.
that we will do.
Yeah, I agree.
I would also say that I think you're really up against it. I think you're headed down the right path. Your presentation and your plan here is data-driven. That's important. Also, what Wayne talked about, what the children think is also important, because we've got to get them eating. But I understand how difficult it is. I've heard the stories. My kids don't always like the meal. again, with the menu on the refrigerator, they do like seeing that. It is something for them to get excited about, so I think that's a good idea again. Maybe if you could just report back to us, and I don't mean come here and present, but just maybe if there is some improvement, if you could send the numbers back here.
Absolutely.
Through
More
Dr.
than happy
Brunel,
to
and
do
just
that.
kind of keep us abreast in the next couple of months of how things are going, and we absolutely will try to stop by and
Please do.
check out the
Come.
menu, and actually, maybe we'll have a bite to eat when we come down. But I want to thank you. I know what you're up against. It's not easy, and I'm
Thank you
sure
very
you're doing your best.
Thank you. Thank
Just
you.
let us know how it
Good
goes.
presentation.
Thank you very much.
Thank you.
Thank you.
Have a good evening. Dr. Brunel?
Okay, so meeting times for budget presentations in the past, these will be held on the 12th and 13th of November. We've typically started them at either 6 or 6:30. They tend to be longer meetings, so I offer that to you for your consideration.
Are there any comments? Have we had an opportunity to look at this?
I can come either time, so.
I'm fine too.
Any concerns,
No, I'm flexible.
Dorothy?
I'm pretty flexible. I would lean more towards 6:30 than 6, but, you know, if we know we have hours in front of us, I can certainly.
Okay.
I know you had a problem with getting in early, that was why we,
It is.
7
It's-
now.
Yeah, it's difficult. 6:30 would be good for me.
That's
Yeah,
fine. Even
that's-
half an hour is better.
Yeah, yeah, 6:30 would work. I can be here for 6:29, I promise.
We're gonna hold you today.
I don't know if he's gonna be here or not.
Yeah. You know, you got a good point.
Yeah.
Okay. I would entertain a motion to begin those meetings at 6:30 and on the dates as illustrated.
I'll make that motion.
Do I have a second?
Second.
All in favor?
Aye.
It's a vote.
Great, thank you. NAEYC accreditation, just wanted to make you aware, as you know, the Auburn Integrated Preschool does have, and that stands for the National Association for the Education of Young Children. They do have this accreditation currently. It takes a tremendous amount of work to prepare the materials that are needed for review. I want to thank Mrs. Chase as well as Mrs. Elaine and Mrs. Levin Savage from the preschool, as well as their support staff for putting that together. And as soon as we hear back, I anticipate it will be a successful. I will keep you apprised, but a lot of work, so I wanted to recognize that.
Excellent.
The next item is the John E. and Ethel E. Riley Outstanding Citizenship Award. Annually, and the copy of the letter is included here, Ellen Gabry, Town Clerk, requests a school representative from the school community to serve. And this year, I'm really happy to report that when we sent out this request, we had 3 individuals reply back immediately, and 3 new ones to you, I would say. In the past, we've had some individuals, and they again volunteered. So we had Donna Heidemann from the high school, Karen Loach from the middle school, and as well as Rebecca Harvey from the middle school. So it's certainly up to you to select who it is that you choose. My recommendation is only, certainly we will send thanks to each of them on behalf of the school committee for having volunteered to do this, and it is a night meeting commitment that they would do with a small group of individuals. With Mrs. Heidemann, she was the first one to volunteer, so I offer that to you as something to consider in your appointment.
Question, are these 3 teachers Auburn residents?
The first 2 are, and the third is not, so actually by virtue, I'm not sure whether she qualifies, although I will tell you, I sat on the committee at one time too, and not being an Auburn resident.
Sure.
But the first 2 are Auburn residents.
Any questions, ideas, comments? I would, having no other criteria, I think maybe we do go with the first person who applied.
Right.
If there's no
That
issue
would
I
with
think
that.
it's recommended by you,
It
then,
is.
yeah, we
Yeah.
should.
Yeah, I mean, I, all of them would be outstanding representatives, I'm certain. But I think, so I just looked at it as, she was the first one, to apply, and it's actually a good problem to have. The school committee's not always had this problem in the past, quite honestly.
Wayne?
I'm with you on this one, as far as, we don't know anything about these people. And how can you really make a vote on something you have no knowledge of?
I mean, I can certainly attest to the fact that they are all, positive and contributing members of our team. And I think any one of them would serve. My recommendation is for Donna Heidemann. She was the first one. She's the social studies teacher. She actually has presented before the school committee in years past, a longtime member of the Auburn High faculty, so I think she
Yes.
would be great.
I think it's a
think they all would be
situation where,
Yeah.
where we could, yearly, we could do
Yeah.
first come, first serve. I don't think that
Yeah.
we need to see their resumes. I'm sure if it was
Right.
someone that was,
Well, even, I mean, you like to know something. I mean, I don't
Yeah.
need a resume, I don't need a freaking big, long thing, it's just something, you know?
Yeah.
I hear what you're saying. It is kind of a shot in the dark. I know even last year we had a couple of good candidates, and we chose the one that wasn't my first choice, but yeah, that's because I didn't know the other lady.
Sure.
And
Right.
so I think I would entertain a motion to, and again, before I even do that, I would like to thank all three of the candidates for putting their name in the hat. It's difficult to get people to volunteer for things. We find that out all the time, and really, I give them a lot of credit for putting their name out there. And I would say next year, maybe just be the first one to put your name in. That being said, I would entertain a motion to recommend Donna Heidemann.
Heidemann, yes.
I'd like to make a motion to appoint Donna Heidemann to serve as a school committee representative for the John E. and Ethel A. Riley Outstanding Citizenship Award Selection Committee for 2015.
Do I have a second?
Second.
All in favor?
Aye.
Aye.
Thank you. We will let them know and thank the others as well.
Yes.
I do also want to let you know that they are seeking nominations. If any of you have any interest in doing so, you can nominate an individual or worthy candidate and let Ellen Gabriel know about that.
Oh,
It is on
award.
the reverse side. So they're accepted through Monday, August 27th, and this goes for anyone. October 22nd, I'm sorry. It's October 27th, my goodness. Acceptance through October 27th at 4 p.m.
Would you know if there's a list anywhere of the previous recipients?
I can certainly get that and share it with you. I have seen the list in the past, but.
It might be on the Auburn website.
It
Auburn
may
Guide.
be. It may
Okay.
be, that may be where I've seen it, but we can certainly email that to you.
Judge, through the
Yes.
chair. Is this any staff member in the schools, or just teachers, or
No,
just
it's
principal?
Auburn.
I mean,
It's Auburn town residents.
This is actually any Auburn town resident
Oh,
for, who could be nominated for this
Oh,
award.
I see, okay, all
Yes.
right, sorry.
Yeah. Included for you is the October 1st counts. These are the official count that's taken by school districts, and this is information that actually that they'll use for their Chapter 70 foundation numbers. And as you can see here, we do have an increase. There are 16 more students this current school year than last. And it's broken down for you by boys and girls, and by grade level, and obviously by school. So just share that as an informational piece for you.
Dr. Brunel, could you
Sure.
just quickly explain to some of the new members how the October report works as far as financing the students, and should they leave the district, or should they enter the district
Mhm.
before or after that, just to...
Right. So this is a snapshot in time that the state asks all school districts in Massachusetts to take. And what that then determines is when they give us our Chapter 70 money, that's the education funding that comes from the state for us, it's based off of these counts. We get some additional funding if students require free or reduced lunch, although they may be doing some reconfiguration around that at the state level in terms of Chapter 70 funding. We get some additional funding for any of our students who may be ELL, English language learners as well. But this is the snapshot in time. So they're going to use this number, the 2,363, as the number for Auburn students. If we have students who have left since then, this is still the number that's used, or were here before. So this is just the official enrollment that the state uses.
Thank you.
Said, thank you.
Just wanted to remind you that the fall special town meeting is Tuesday upcoming, October 21st. We will send to you, we did receive a copy of the warrant articles, we'll send those to you tomorrow via email. They'll be there on that night as well. But typically, we've had a meeting, generally started in the guidance office beforehand, and then we don't actually, we take a recess for the actual special town meeting, and then we adjourn following that in case it requires any discussion by the committee. So I think, based on what I know to be right now, if we started at 6:30, that would certainly be ample time. The town meeting starts at 7, but it's up to you when you want to start that.
Does anyone have a concern with starting at 6:30?
No?
I would like to, get my feet wet first before
Yeah.
we can walk.
Sure.
through it,
Yeah,
so.
well, we don't cover a whole lot in there. It's not
Yeah.
really gonna be very involved, so
Okay.
I think
Yeah.
6:30
No,
gives
I'm
us
good with that.
plenty of time, and I would entertain a motion.
I'll make that motion to start at 6:30 on the 21st.
Do I have a
Second.
second?
I'll
All in
second.
Aye.
favor?
Aye.
Aye. It is a vote.
Just wanted to remind you that our next school committee meeting will actually be on Monday, November 3rd. That's not our typical meeting date, but if you'll remember, the MASC, Association of School Committee and Superintendent Conference, runs from the 5th through the 9th, so that's the reason. So just as a reminder, we'll obviously send it out to you too. And then, just wanted to take this opportunity to really thank our PTOs, our booster clubs, the FAME organization, ARC Junior, really as well as those individuals who serve as youth league coaches, as Girl Scout leaders, Boy Scout leaders. I had the opportunity to present to the District 1 PTO just last night, actually, before the SBC meeting, and shared these same sentiments with them, as well as my most recent Rockets review. It really is, I mean, I know that we talk an awful lot in our meetings about the team effort that takes place, and certainly the members of the schools team are critically important, but I think as you heard tonight from both the health services and food services programs, that it's really a connection with the families and our community and beyond that. So it's work that we really can't do alone, so I just wanted to publicly thank them and recognize the work that they do in supporting us, so it really is wonderful and appreciated.
Any comments? None?
Okay. Just wanted to make you aware, and we'll actually have the winners of this project coming to the November 3rd meeting, at least is our plan. Liz Palmer is the graphics teacher at Auburn High School, and she recently informed me that Mr. Bill Maloney from Non-Metallic Solutions, it's a business in town, has sought their help in designing a new logo for his company. So the students are very busy in doing that. I think it's a great connection, further connection to the community, gives them real life experience in doing this. And they're going to be, they actually have made the presentations to them. They've asked for, today we learned, they've asked for some refinement around those. And then on the November 3rd date, our intention is to have Ms. Palmer here, as well as the winning student or students to come to be recognized. So I think it's really a great additional connection that's being made. And he plans to use it on flyers, on T-shirts, business cards, so it will get a lot of recognition beyond the Auburn community too.
Excellent.
Through the chair, is this something that happens from time to time, or is this something brand new, or?
It's something that
The business
we've really
connection?
been trying to promote, and after this is done successfully, we're really going to try and promote it even more. I know that our graphic arts students have in the past worked, like say with Auburn Rec and Culture, have worked with the other town departments to do things,
Yes.
but even to reach out and broaden that to the private sector as well. So
This is
we're going to really
awesome.
try and promote it, yeah. I agree.
Excellent.
I
Yeah.
agree.
Any comments?
I think it's great.
Yeah.
We now move on to unfinished business.
So wanted to update you with the accelerated repair program. If you remember, this is that will participate MSBA up to 50% of the replacement of the roof at the middle school, the roof at Bryn Mawr, and the boiler at the middle school. So recently, the owner's project manager, we had shared with you that MSBA determined that it's a random selection. We actually have the same one we have for the school building project, Skanska. And they can have a contract of up to $15,000 for all three of the projects, and they'll help to do the coordination around those. So it is our recommendation, Mr. Barber's, Mr. Fahey's, and mine, that you approve and allow for us to execute that contract with them for a value not to exceed $15,000.
I would entertain a motion.
I'll make that motion.
Do I have a second?
Second.
Any discussion? All in favor?
Aye.
This vote.
And if you remember, these funds will be derived from, we had to notify Mr. McCarthy back in early July, either from school choice for the Auburn Middle School or revolving accounts. So we've got money appropriated for this with your approval already. Just a reminder that the school committee / superintendent joint conference will be held down in Hyannis from the 5th to the 9th, and I know we all look forward to it. And as soon as an agenda for that, a conference agenda comes out, I anticipate it could be any day. We will get that out to you, but I think you'll also get copies as
At
well.
home.
At
Okay.
home.
I think
We'll send it to
something
you.
came, yeah.
You may have, okay.
Yeah,
Yeah.
Okay.
something came.
Okay. School Building Committee, we had our meeting last night. It was a very brief meeting. Lamar Pagano was not in attendance to report, but we continue to make good progress, and in fact, the leadership team is going to be taking a tour. We're going to bring them on a tour tomorrow to see it, but if you look at the middle school, they've actually started some drywall in there. The brick veneer is nearing completion on the outside, and we continue, as per our meeting this morning, our construction meeting, that we are still on time and remain on budget, so awesome, very positive.
Excellent.
Yeah, that's great.
Now move on to new business.
And I prepared for you the educator plan. This is something that all of us across the Auburn Public Schools, all of us are doing this, and it just expands upon the goals that you've previously approved. I know that you're just seeing this tonight, so if you'd like, I would be happy to answer any questions either tonight or at the next meeting. But it really just outlines, certainly not all of the steps, but I would say some of the major milestones that I will be working toward in accomplishing all of these goals.
Do we have any questions tonight or comments?
No, can it be considered unfinished business, though, so I can
Mhm.
look through and see?
Absolutely.
Yeah.
Sounds good.
And then finally, the upcoming events. As you can see, our school councils are very much underway in doing their work. We've got dances taking place. Homecoming is next weekend. There will be events at the football game. I encourage people to attend that. They're actually going to be doing a unique and new fundraiser at halftime to help raise funds for FAME to send our students on their trip later this spring that you approved last year. So, and then all day on Saturday in conjunction with Auburn Rec and Culture, there are events taking place, athletic events as well as different events from the culture group that'll take place. So, a fun time for people to go.
Through the chair, since most of us weren't here last year, where are they going?
I believe they're going to Florida for
Oh,
their
wonderful.
trip
Band.
to compete with the Rocket Band. Yeah.
Oh, wonderful.
And it's at, any trips like that are at a substantial cost, so they're really working in earnest to raise money to reduce that and make sure that everybody can go, so
Oh.
it's great.
That'll be an awesome
It
experience.
will. Thank you.
Through the chair, I just have a comment about one of their other fundraisers, the Bemis Nursery.
Yes.
I brought the kids out there, and we had a blast. It was such a good idea, well done, so, yeah,
The
kudos to
scarecrow?
them.
Through the chair, yeah.
And I still have it in my breezeway, it's adorable.
Oh, good.
Yeah, it's great.
They are being, through the chair, they're being very creative, which
They
is,
are, yeah.
which is great.
Now move on to business and financial.
Good evening, everybody. In front of you, you'll see a listing of the transfers that we're presenting. These transfers don't have an impact on the series that the fundings are being transferred from. In essence, these are to allow for us, we had modified the staffing to correctly assign them to all of the school locations that they were physically being assigned to. And in doing so, this allowed for us to modify the remaining amount of funds that were budgeted respectively. And so this allowed for the compensation for pretty much all of those that were in question. And that's what identifies predominantly all of the transfers in this particular session. Do you have any questions?
I have a question, Mr. Barber, not on that, but I was just wondering how that 37% rate hike for National Grid is going to affect the schools for electricity. Are we locked in or something, or? Oh, we are?
Yeah.
We have, basically what we do is we go through annual contracts and it allows for us to lock our rates in
Oh.
for that fiscal year that we are, from the point in time that the contract's put in place through a 1 year from that particular point in time. So it's not going to be anything that's going to currently impact us now.
Oh, good.
One of the items that has been coming up in our budget meetings is obviously looking at factors of those natures, because that's going to be impacting how we're going to be requesting and what we need to identify for our request for the fiscal year 2016. And so that will come into play at that particular point in time. But as of fiscal year 15, it does not have an impact on us.
Oh, good, that's great. Okay, thank you.
Page?
Could you add the residents on that list?
We'll make a note. Okay. In addition, you'll see that there is a transportation update. For the most part, all of our buses were running at correct time, dropping off students across the board and pretty much on time. At one point in time, it was 5 out of 6 schools were receiving all their students on time. There was one particular school, which was Mary D, that was having one bus, or 2 buses actually, that were arriving a little late. Unfortunately, that was due to the fact that the bus, two of the buses, bus number 7, bus number 10, was arriving at the school for approximately 10 minutes waiting for the ability of dropping the students off and then having the transition over to the second school. With that being the case, we were able to bring in one of our, two of our IAs that actually allow for our bus to be, or for those students to be released from the bus, actually about 15 minutes early. So now the IAs are in essence watching them 15 minutes earlier than most of the other schools. By doing that, that's now allowing for our bus to make it over to PAC and actually meeting the timeframes that were basically in question at that particular point in time.
Okay.
Yes, sir.
Yes, I heard about that problem, and I talked to the superintendent about it, and you guys got right on it, and I want to thank you again. This is the second time that I had gotten a complaint about that bus issue, and it was fixed like immediately. And it's really good to know that we get a team that really straightens out things really quickly, and thank you.
You're welcome. One of the things I've got to identify is that, Dr. Brunel and I, whenever there's an issue, especially with transportation, if we don't have the ability of bringing the students and physically getting them to school on time, not to mention getting them to school at all, obviously that's already the biggest objective to trying to get an education. So we try to make sure we set our goals to be able to, achieve that relatively easily.
And you're doing very good at it.
Appreciate it. Thank you very much. With that being the case, just as a point of reference, we will be starting the process of transportation. Our transportation contract will be coming up, and so we'll be starting up the phases actually over the course of this next month. I was at a conference this morning for 3 hours to actually go over the evaluation processes, the steps and stages to be used to actually draft your particular contracts and how to acquire the information necessary to, in essence, to get a good contract for the district. So we'll be beginning one of those processes again because our contract for our transportation expires this year, and that way we can make sure that that's taken care of rather than waiting until it's too far along into the school year.
With that, I'm pretty happy with our transportation now.
I'm sorry, didn't mean to interrupt.
Our transportation provider, I meant to say.
Over the past month, or actually over the past 3 months, each time that I've had an issue or there was a concern with respect to AA transportation, I made a phone call to Miss Linda. She responded, got back to me relatively quickly. I'll be honest with you, any issue or problem that we've had with the transportation company, they've been resolved very quickly, which has been a very positive attribute to being able to communicate back and forth. And again, that goes right from their director per se to their owner as well.
Excellent. Good. Is that all you have, Mr. Barber?
That's all that I answered.
Well done. Thank you.
You're welcome.
We now move on to policies.
There's a policy in here that we've had actually on the books since 2009, but as part of the additional 2 percentage points that we earned, if you remember, for reimbursement for the middle school, this we need to add in regarding Energy Star equipment. It is a practice that we've had. Putting it into the policy solidifies it, so it is my recommendation that you approve this amended policy.
I would entertain a motion.
So moved.
Do I have a second? Any questions, comments? All in favor?
Aye.
Aye. It is approved.
And then, I'm sorry.
Go ahead.
Lastly, unfortunately, our long-term occupational therapist, who's been working in the district for a number of years, has recently accepted a position much closer to her home. So we want to post for this, and obviously it's a good time for us to update the job description. She was an integral part of actually creating this, so it defines exactly what she does. So it is my recommendation that you approve this job description.
I would entertain a motion.
I'd like to make a motion to approve the job description for district-wide occupational therapist as presented.
Do I have a second?
Second.
Any comments?
I have a question, actually. Who hires this job position? Is it through you or?
Well, actually, the director, so through the chair, the director of pupil services, actually, she would be her immediate supervisor in coordinating. This individual actually provides consultation and assessment services for students across the district. So, but as with any other hiring, she'll make a recommendation to me, and then I would negotiate a contract with that individual. So, but they would do the vetting, and there's actually a team of them who will be
Okay,
doing
so
it.
it's not the school committee?
Correct, no.
Okay.
Nope, it is not.
Now, is this position open now? Has she left?
No, she's not yet left. Yeah, but we're looking to fill it as soon as possible.
Sure.
We have interviews on Monday. We are confident, she's worked really closely, the soon-to-be departing individual with the Director of Pupil Services. She does not provide direct services to students, but if we need to, if there is any lag time, because depending on who we hire, they may very well need to give a notice to their current
Sure.
employer. But she has reached out to the collaborative, if we need any of their services, we can hire them on an as-needed basis. So we've got a plan.
Any other questions? All in favor?
Aye.
Thank you.
And we do not need to go into executive?
We do,
We
actually,
do need to
yes.
go into executive
Briefly.
session. I would entertain a motion to go into executive session.
I'll make the motion to go into executive session.
Do we need to read that out?
Through the chair, you should read out the reason for it. You could, it's on the agenda, I think.
It's this,
Yeah.
right here.
Yeah,
Oh,
Yeah. She's got one, yeah.
yeah.
I make the motion to enter executive session per MGL Chapter 30A, Section 21A2, to discuss strategy with respect contract negotiations with union personnel.
Do I have a second?
Second.
Any comments? All in favor?
I do.
Roll call?
Mrs. Harrington?
Yes.
Ms. Sutton? Mrs. Holloway?
Yes.
Mr. Page?
Yes.
Mr. Scobie?
Yes. Adjourn?
Yes, so you'll return, through the chair, you'll return to open session only to adjourn, so we'll actually start the recording.
Okay.